Alright, so this is going to be our presentation on the drug Aricept, also known as donepezil. My name is Jake Capko.
And I'm Michael Berger. This drug is an acetylcholinesterase inhibitor. So acetylcholine is the most abundant neurotransmitter in the brain, and it's very important for the functions of learning and memory. And acetylcholinesterase is the enzyme that breaks down acetylcholine. So as a person ages, the production of ACH in the brain will naturally decrease, but in Alzheimer's disease, for many reasons, the concentration of ACH in the brain is decreased more than normal, which will lead to the cognitive defects that we see in the disease. So this drug will block the activity of acetylcholinesterase, which will decrease the amount of ACH being broken down, which will mean that there is more ACH left in the brain that can perform its normal functions.
Alright, and then the indication and dosages for Aricept. It is indicated for the treatment of dementia, for Alzheimer's, for all severities. And then for the dosages, mild to moderate Alzheimer's disease, 5 to 10 milligrams is recommended once daily. And then for moderate to severe Alzheimer's disease, 10 to 23 milligrams is recommended once daily.
For the administration of this drug, it is found in a tablet form, so you can get it in dosages of 5, 10, and 23 milligrams. It is taken orally, so you don't want to crush it, cut it, or chew it. You just want to take it whole. And this drug, you want to allow it to dissolve on the tongue. So you don't swallow it whole, you just allow it to dissolve on the tongue and then follow it up with water. And all the dosages are recommended to be taken in the evening just prior to going to sleep, and you can take it with or without food.
Alright, and then some precautions, contraindications, and adverse reactions. Contraindications for this drug include hypersensitivity to donepezil hydrochloride, which is another cholinesterase inhibitor, and then piperidine derivatives, which are drugs that are used in hair loss prevention products. And then some cautions for this drug include if the patient has bradycardia, cardiac conduction defects, and then a GI bleed or ulcer, whether or not they have a history of those two conditions or a risk for those two conditions, and then a bladder obstruction.
Some more cautions include having a seizure disorder, asthma or COPD, or if the patient weighs under 55 kilograms. Some common adverse reactions include nausea, diarrhea, insomnia, vomiting, muscle cramps, and syncope. And some less common adverse reactions include Stevens-Johnson syndrome, which is a rare serious disorder of the skin and mucous membranes. It begins with flu-like symptoms followed by painful red or purplish rashes that spread and blister, and it affects the top layer of the skin, which will die and shed. And then some more adverse reactions would be urinary obstruction, anorexia, or toxic epidermal necrolysis.
Alright, and then toxic epidermal necrolysis is a rare life-threatening immunological disorder of the skin, which is characterized by blisters which meld together to cover a substantial portion of the body, up to 30% or more of the body. And the skin then begins to peel or slough off, and then the exposed layer of skin underneath this is red, which suggests some severe scalding. And then with this condition, the mucous membranes of the body are often involved.
So for the mechanism of actions and the pharmacokinetics, kind of already described the mechanism of action. It reversibly binds to and activates acetylcholinesterase, which we mentioned will then decrease the breakdown of acetylcholine. For the pharmacokinetics, it gets metabolized in the liver and then gets excreted in the urine and the feces. It has a very long half-life of 70 hours, and the rate of metabolism is not affected by food.
Alright, and then monitoring. While taking this drug, The only thing the patients should really be monitored for that we've found is for signs and symptoms of a GI bleed.
And for special considerations, the biggest deterrent for the use of this drug is that it's very expensive. The cheapest available dosage that we found was $500 for 30 pills, which comes out to about $17 per pill. And also for women, if a woman is pregnant, caution should be advised. There's a risk of fetal death at 7 times the maximum recommended human dose. There's really no reason to take it that much of this drug. And also with lactation, no studies have been conducted, so caution will be advised in those situations as well.
All right, and then special considerations continued. With an overdose, it is always important to contact a poison control center to determine the latest recommendations for management. And then signs of toxicity with this drug include reduced spontaneous movement, prone positioning, staggering gait, lacrimation, which is just tearing up of the patient's eyes, clonic convulsions, depressed respiration, salivation, meiosis, which is excessive constriction of the patient's pupils, and then tremors, fasciculations, which are muscle fiber contractions that are spontaneous and that are visible under the skin but do not produce joint movements, and then a lower body surface temperature. Implications for the physical therapist. This drug prevents the reuptake of ACH in the brain by binding to and blocking the action of acetylcholinesterase. Therefore, there is more acetylcholine available in the brain, which functions in alertness, memory, and thought and judgment. Utilization of this drug may help with reducing the patient's agitated behavior, improve their cognitive function, mood, and fitness level. So for PTs, this could indicate that the patient might be easier to work with due to an increased alertness level, cognitive function, and fitness level. It could mean that the patient might be able to better participate in treatment and therefore have a more active role in their own rehabilitation.
So just an overview of studies. Tons of studies and papers have been done on this drug. Over 1,000 papers published since 1996. Aricept is the most utilized drug for Alzheimer's disease in the world. Most studies show that this drug provides benefits for cognition, behavior, activities of daily living, and slows the progression of the disease. However, some studies have shown that this drug does not have any benefit for patients with Alzheimer's and has many adverse reactions, which we mentioned before. Finally, it is not a cost-effective treatment, which we also mentioned, the price of the dosage being so high.
All right, then these are our references. Thank you guys for listening, and we hope you learned a little something today.